Hello, I'm Claire. I'm one of the podiatrists here at Randell's Footcare. I'm here to tell you what it will be like when you come for your appointment. If you're a new patient, you should have been sent one of these forms to complete with your medical details on. If you have not been, then we'll give you that when you first arrive. If you're a regular client of ours, then we'll go through your medical details, double check there have been no changes, like your medications are still the same, you haven't developed any new allergies, no problems like that. When you first come into the clinic, we'll then want to check your feet. The first thing we want to do is to check the condition of the nails and the skin. So, do we have healthy nails? Do we have any problems going on there? Does the patient have any problems? Are they suffering with any pain? Is there anything that's concerning you? We'll have a check all over everywhere. We'll have a look underneath, looking at the condition of the skin. Do you suffer with any hard skin, a fungal infection, a verruca, anything that perhaps you're not even aware of that you've got? It's very useful having a foot check to have somebody who knows what they're looking at check that everything is okay with the feet. We do this using a Doppler. So the Doppler bounces sound waves off of blood flow, and then we can hear the circulation. So I can hear that Matt's pulse is very regular. It's about 60 beats a minute, which is excellent. And we've got 2 noises per beat. That's a biphasic pulse, that's really good. If you come for a diabetic assessment, we're also going to have a look at your nerve function. So we're going to check your sensory nerves to see if you can feel properly. We use a few different tools for this. This one is a monofilament. This is a piece of nylon fibre that bends under 10 grams of pressure. This allows us to test if you can feel light touch. We also have a vibratip. This will vibrate, and we can check by vibrating down your toe if you can feel okay. And this is a neurotip, which has a blunt end and a sharp end, to see if you can differentiate between blunt and sharp, and that will tell us if your pain nerves are working properly. During your appointment, we would also have a look at your footwear, see what kind of shoes that you're wearing, give you advice on things that will be best for your foot function, shoes that will support you best. We'll have a look at your skincare regime, ask you about whether you're moisturising, and talk about whether you need to use moisturisers to hydrate your skin, or whether if your skin is too sweaty, you might need something to help to dry it out. Depending on what you've come in for, we might cut your toenails for you. If you have thicker toenails, we can also use a drill that will file them down and thin them down for you. If you have hard skin, we can remove that. Corns can be removed on the day, and people go out feeling much more comfortable. If you need a more advanced treatment like verruca treatment, then that would be taking place in our Sheringham or our Norwich clinic. If you're having a problem with your foot function, the mechanics of how your foot work, then we'll talk through with you how your foot is functioning. We can use aids like this to explain to you exactly how things are working, where a particular area of problem might be, and talk to you about how your foot works and the problems that may be going on there. You may possibly need to be referred on for a more thorough assessment, like a biomechanics assessment.